The National Agency for Food and Drug Administration and Control has launched a special federal task force to tackle counterfeit drugs and unsafe processed foods. We have more in this report.
The fight against fake and substandard medicines as well as unwholesome processed foods has long been a public health battle. This newly inaugurated task force will monitor and regulate the influx of these dangerous products across the country.
We are trying to unlock the healthcare value chain, which is the third pillar of the President's agenda. To do that, we need a strong regulator, because a strong regulator will help the industry get the muscle memory to be able to, the strength to be able to produce good quality products. If you don't have a regulator and you produce something that is good quality, someone else can produce a substandard and compete for the same market and undermine you. And we don't want our country to be known for producing products that are not at the quality that is necessary. The success of this task force at the federal level, zonal and state levels, when the governors inaugurate them, depends on our ability to work together swiftly, decisively, and transparently. We must enhance surveillance. We must enforce the regulations that are there strictly, and educate the public to recognize and reject counterfeit and unwholesome products. Let me be clear. The fight against counterfeit drugs and unsafe food is urgent. Every delay that we make costs lives and livelihoods.
At the inauguration, NAFDAC Director General Mojisola Adeyeye described the spread of counterfeit medicines and unsafe foods as a serious threat, demanding urgent action.
It is easier to destroy than to build. But that is why this inauguration is extremely important. What we are discussing now is market control. How do you control the market to the benefit of the consumers? That is why we needed our forces. We cannot do this alone. NAFDAC cannot exist without security forces. We cannot. Because we are dealing with some criminals who don't care about you and I, about life. They don't care about their own relatives, even their own lives.
Working with the Ministry of Health and Social Welfare, the task force will spearhead efforts to rid Nigeria of fake medicines and harmful food products.